So joining us now, MSNBC contributor and former White House Health Policy Director, Dr. Kavita Patel. I almost got sidetracked because I just saw that picture of the hand with measles all over it, and I thought, good grief. It is considered one of the most contagious diseases known to humans. Are we just seeing the tip of the iceberg here?
It is, Alex, and we are seeing the tip of the iceberg. This is how contagious it is. If you have one person infected with the measles and there are 10 unvaccinated individuals around that person, 9 out of 10 of them will get the measles. It's almost 100% hit rate, which is pretty effective for a virus, but unfortunate for us. And in terms of tip of the iceberg, we're all trying to figure out, like, when does this kind of plateau? This is the highest outbreak Texas has seen since 1992. And we hope it doesn't get to the point where it reaches those numbers of cases. And then it was in the thousands. And now we're at just 90. We want to keep it that way. But when you think about how many people you can infect and how quickly it can spread, and I hate to say it, Alex, we're coming up on spring breaks, kind of big gatherings, times when people are going to be around other people, pretty easy to see how this could spread.
You should have seen my face. My jaw dropped when you gave that. I mean, the success rate of measles being passed along, that's incredible. The bulk of these cases are in Gaines County. It does have the highest vaccine exemption rate in the state of Texas. That's nearly at 18%. And the Wall Street Journal reports that RFK Jr. is preparing to fire members of the CDC committee that decides whether and how to recommend vaccines for the public. The first CDC vaccine meeting under the Trump administration has also been postponed. Big picture, what are your thoughts?
Yeah, I think the big picture here, Alex, which is unfortunate, is that the institutions with which I've always held, regardless of administration, very high regard, even during the first Trump administration, the CDC, mostly, let's be honest, because of the efforts of thousands of federal workers inside these agencies, that trust is in jeopardy right now, not just because of what you were talking about previously with firings or checking in on what people are doing in their jobs, but to your point, these advisory committees, these are committees that are not stacked with just someone's friends, Alex. These are people who have decorated careers and have real expertise that we, the public, need in these areas of vaccine safety and effectiveness. So when you think about replacing them, replace them with whom and with what purpose? And how can you trust that? And then the recommendations coming out of that committee go to a CDC director, whom you also probably should question the trust in, because he's been a known anti-vaxxer since he was in the House of Representatives decades ago. So this is a pattern that's developing that is unfortunately going to not just affect our kind of time right now, Alex, however this administration lasts, but well beyond it.
Yeah, exactly. The research, those people that have devoted their life to trying to prevent disease down the road that are being cut, and all the research that goes along with them, it either gets suspended or goes away. It's actually stunning, all of this. Let me talk about measles specifically, though, because in 2000, it was declared eliminated from the U.S. What happened? Because that's no longer the case. And is today's medical community prepared to deal with this outbreak if it goes from New Mexico and Texas into other states?
Yeah, great question. So very briefly, like, what happened after 2000 was a combination of misinformation. There was an article in a very prominent medical journal that had a link between vaccines and autism. And you and I know that if you tell a mother or a father, anybody, that their child could be at risk of something like autism from a vaccine, you could imagine kind of what happened in the years following that. That journal has since retracted, and even the author and others have kind of been impugned for what they did and wrote, which was inaccurate. But the damage was done. And then I think that just unraveled a thread, Alex, that and some other studies that were also, unfortunately, not accurate, unraveled a thread that brought forward people's kind of personal rights, which I'm in favor of. Anything we do to individuals, it's their right. However, I will say that many people have exerted their individual right in environments like schools, like children, like crowded environments where they're putting others at jeopardy. And I think that's what we are now seeing. And so we're seeing these pockets of resistance. And it's a problem for doctors because many of us don't recognize measles. We haven't seen it in so long.
Dr. Kavita Patel, I know, unfortunately, you're going to have to come back soon, although I'm always glad to see you. But thank you very much.